If you or a family member uses oxygen tanks, this video will be a helpful resource for you. We will go over safety and handling of the tanks, using a regulator and an oxygen conserving device, as well as some helpful tips. We will be starting off with some safety tips. Make sure people operating the tanks are properly trained. Do not store tanks near sources of sparks or flames. Keep dirt, grease, or oil-based products away from the tanks. And do not smoke near the tanks. Whether you have a home fill station or you pick up the tanks yourself, we have some storage and handling tips you should keep in mind. When storing your tanks, choose a cool, well-ventilated place to store them. Store the tanks in a cart, floor stand, or have them lying on their sides. Do not allow smoking or open flames near the storage area. Protect the tanks from temperatures above 125 degrees Fahrenheit. Be sure not to leave tanks in the car during the summer months. When handling your tanks, do not drop or let cylinders strike each other. Protect gauges from damage. Always open tanks slowly, and be sure to remove the white seal before putting the regulator on the tank. Now, with all of that out of the way, let's go over using the tanks with a regulator and an oxygen conserving device. Side note, an oxygen tank is one of the most common ways oxygen is delivered for portable use. Since oxygen is a drug, it is very important to set the gauge correctly. Your doctor will advise what to set your liter flow to, so it is important to follow their recommendation. Let's go over how to attach the regulator to the tank. Oxygen flow control regulators and conserving devices are pressure-reducing devices designed to regulate or lower oxygen pressure from a cylinder to levels that can be safely used by the patient. A regulator simply regulates the flow from an oxygen cylinder. The first thing you will want to do is position the tank so that it is facing the operator. Remove the white safety tape. Raise the lever on top of the tank to the vertical position. Look for the two pins in the regulator yoke. Note, be sure the washer is in place. Pass the regulator over the lever and neck of the tank, matching the two pins on the yoke to the two holes on the neck. Hold the yoke in place while tightening the T-handle on the regulator. Lower the lever on top of the tank. Now you can attach the hose to the tip of the regulator. Now we have the regulator installed on the tank. The next thing we will need to do is turn the tank on to open the flow of oxygen. Turn the top lever counterclockwise 1/4 turn. Adjust the oxygen flow to the liter flow that the doctor has ordered. Some tanks may not have a lever attached to the neck and will require a key to open the tank. This is what it will look like. The key will have an opening that is shaped just like the top of the tank. You will need to fit the key onto the top of the tank and follow the same directions as above for turning it on. Turning the tank off will also be opposite of turning it on. Either turn the lever or key clockwise, 1/4 turn to the off position. Now, if your doctor has prescribed an oxygen conserving device, it will look a little different, but will essentially get installed the same. A conserving device is an entirely different device that delivers a pulse of oxygen as the patient inhales. Here's what that looks like. To install it, you will follow the same steps as the regulator. Thank you for watching. Please like this video and subscribe to our channel for all of our latest content.